Hi, so tell me your name, where you're from, and your background.
I'm Gordan Srkalovic. I'm a hematologist oncologist from Lansing, Michigan. I was born in Bosnia, in Sarajevo. I left my country during the war, and then I did my fellowship at Cleveland Clinic, and then moved to Lansing.
Wow. And how did you first become interested in Castleman disease?
And actually, first case of Castleman I had as a fellow at Cleveland Clinic, and then I had several cases after that. When I moved to Lansing, cases were not so common, but then I had during the year several new cases, and interestingly, all of them were multicentric Castleman's disease, except one lady which was unicentric, and she was easier case.
And what are some new advances or research that you're doing that you're excited about for Castleman in the future?
So at the time when I was at the Cleveland Clinic, we treated patients just with the steroids, and that was standard of care. However, when I moved to Lansing, I had a couple of cases of young patients with multicentric Castleman's who were actually both HIV and HHV-8 negative. Those were very challenging cases. One of them spent probably around 3 months in the hospital. During that period, he went 3 times to intensive care unit. He survived. I treated with different treatments, mostly based on multiple myeloma treatments. And finally, he went to Chicago for bone marrow transplant. And he's now actually good, well, and he got married, and I think he has child on the way. But however, that pathway was very challenging and very traumatic, so he barely survived. So it was obvious that we need better treatments, more targeted treatments, and that we need to find a way to deal with those cases. And fortunately, we found a new medication like IL-6 inhibitors, which are really giving patients a chance of better quality of life and better survival.
Great. And so then how did you get introduced to the CDCN, and what role do you see them playing in advancing research
Originally,
in the future?
because I was involved in a clinical trial with IL-6 inhibitor, and then and I was in contact with Fritz at the University of Arkansas regarding a couple of my patients. So from that connection came actually invitation to join group of other physicians.
Great. And what would you say to other researchers or physicians looking to get more involved?
Well, I think we have a pretty daunting task in front of us. We have one drug which is available, but we still don't have enough information about Castleman's patients. We don't even know who they are, how many of them are there in the community. So I think we have several tasks to really achieve. One is to really form kind of a registry of patients with the Castleman's. We also have to really play advocates for those patients and help them to really find right place to be treated. And then we have to work on really pinpointing biology and pathology of the Castleman's, and then work on better treatments.
Great. And then what would you say to patients out there seeking more information?
Well, I think a website which we offer to patients is excellent beginning, and it gives a lot of information about disease, and also gives patients number of addresses that they can find, and find physicians who have expertise in Castleman's, and help them to get easier through the process. And the website is really helping because I get calls from a couple of physicians in the Michigan area or Michigan State who learned about website, found my name, and then consulted me, and I'm actually helping them to treat patients remotely on distance.
Fantastic. Thank you so much.